welcome. My name is Barbara Link, and I am a quality improvement advisor with Superior Health Quality Alliance, and we cover the states of Michigan, Minnesota, and Wisconsin. Thank you for turning into this interview today. I'm talking with Sue Huntenberg, and she is one of our patient and family advisors for our Superior Health Quality Alliance Patient and Family Advisor Council. And today she's going to be talking with us a bit about her experience as a caregiver and an advocate for her mother when her mother transitioned from a rehab unit into a skilled nursing facility level of care, and a little bit about her role with her mother's care as well as outcomes. And at this point, I think I will turn it over to Sue.
Thanks, Barb. I think I want to tell you my mom's name. Her name was Flo Huntenberg. She was the mother of 6 children, grandmother of 10 children, and great-grandmother of 12 children. She was married to my dad for 32 years before he died of colon cancer metastasized to his liver, and he died at the age of 57. So she was a young widow, but lived a full life. She drove a bus for 35 years for folks with disabilities, and she actually did that until the age of 75. She finally retired at that time and contributed a lot in her work with those folks. Right after she retired, she had knee surgery. She thought she was having a hard time getting up and moving, and she thought it was her knee. The ortho person said he thought so too. He did a surgery. She did not come out of that well. It seemed to trigger what we thought might have been early Parkinson's. It made it much worse. We had to, when she got out of the hospital, we had to have care come into the home. And eventually, in that 8-year period, she ended up needing care, extensive care, over 12 hours of her day. So from the time she got up until she went to bed at night. She ended up with pneumonia during that time. And so they took her to the hospital. And after that was over, they thought rehab might be helpful, might help strengthen her. So she was put into a rehab unit. She didn't do well there. She kind of plateaued on her strength, and we knew that she wouldn't be able to go home again. And we had to have that really hard meeting with social worker there and everyone else. And all 6 of us children are crying, of course. And she, because that's not what her wish was, it wasn't what our wish was either. And she sat up taller in her wheelchair and she said, "What else can we do?" And she said, "It's not your fault." Bless her for that. But it was a difficult time. But during that transition time, a couple of the rehab assistants said to me, "Don't let them put her on the Alzheimer's unit." She did have subcortical dementia, which is frequently part of Parkinson's. So she did have that diagnosis, but she knew who we were. She knew who everybody was. She never forgot a story. She never forgot a face. She did forget the days of the week. She did forget a lot of that, but it wasn't anything that affected her quality of life. So they said, don't let them put her on the secured Alzheimer's unit. That's not where she needs to go. And I agreed with that. But before her placement, the social worker came in and gave her, I don't know if it's a cognitive test, whatever it is that they gave her. And based on that number, on that test, and her diagnosis of mild dementia, they determined that the secured Alzheimer's unit was where she needed to go. The director of nursing, so I met with the director of nursing and the social worker, and they said that people with dementia like to be together. because then they didn't feel different and it would be more comfortable for them. I knew this wasn't a good placement. But they said, they also said, well, your other option, they don't, where the folks have mild dementia, they don't have a Hoyer lift there. And my mom had extensive physical needs. She could not help herself physically in any way. So our option was the Alzheimer's unit, secured Alzheimer's unit. But I knew she needed social interactions. You know, that was the most important thing to her. That was her quality of life. She was an extrovert. She was a helper. And she needed to be able to talk to people. She was a talker. They said this was the only option and give it 3 weeks. Tried for 3 weeks. Let's see how it goes. So they placed her there despite my objections. And the staff there was superb. They were kind. They were gentle. They said, we will do whatever she wants, she can have. You know, if she wants to stay in her room the entire time, she can. They were so good. But none of the other people on the floor talked, and none of them were able to even feed themselves. My mom talked. She could feed herself, but she needed help with everything else. So the next day after that, when I went to the Alzheimer's unit, she was in the dining room eating breakfast. And when I got in there, she was sitting at a table by herself facing a blank wall. It broke my heart. I sat down next to her, tried to be positive about it. She clearly was very sad. I talked to the staff in the dining room and said, this is not going to be okay for her. She needs some interaction with people. I think they were limited in what they could do, but when I went in the next morning, they had moved her to a table still by herself, but she was looking out a window. I think that's all they could do. Everyone else in the dining room was being fed by an assistant. So they were very busy. And I think they were grateful she could feed herself. But I knew this wasn't going to work. This was not going to work for her. So while she was napping, I went to all the other floors to see if there was a better option for her. And there was a unit that had Hoyer lifts because every single person on that floor needed extensive physical assistance. I talked to the nurse on that floor and said, my mom has mild dementia, but she needs people to talk to. Would this be an appropriate placement? And they said, absolutely, it would be fine, but we can't say that. So they said I needed to be the one to do that. So on the third day, let me just turn off, hang on, I'm sorry.
It's okay.
So I thought, okay, we have this. But so on the third morning, I went in to the dining room for breakfast, and she's sitting at her table by herself. And I'll never forget, she looked at me and held my gaze, and she said, help me. That's all she said, help me. So I sat next to her and I said, I will do that. I will help you. We will find something better for you. I am so sorry. But that night when I went back to her house, I sat in the middle of the living room floor and I screamed and I cried and I said, help me, someone help me. You know, I didn't know what to do. It was horrible. I felt powerless. So as the week went on, she became more depressed. She stopped eating. She stopped talking. One day I was walking her in the hall in her wheelchair and she spotted a woman who had been in rehab with her. And they both grabbed onto each other's arms and they both started to cry. And they asked each other, are you okay? Are you okay? And well, my mom, I knew, had a strong advocate in every one of us, all 6 of her kids. This woman didn't. They were the only 2 residents on the floor who could talk, who could feed themselves. But I can only guess that this woman had a similar score, a similar story to my mom's, and this was where she would sadly spend her last days. So after that happened, I thought, I can't wait 3 weeks. I cannot do this. I went back and I found the director of nursing, and she said that the score on the test indicated that she needed to remain where she was, and that's a cured Alzheimer's unit, and there was nothing I could do about it. She told me that it was an upper administrative decision, so the case was closed. This is what it was going to be. But in such a short period of time, I couldn't believe how quickly my mom declined. So after talking to the director of nursing, I thought, this is a upper administration decision. I'm going to go find the upper administration. So I went down to the head administrator of the facility and made an appointment to see him. And when we met, I told him that I was sorry to have bothered him, but that the director of nursing had told me that the placement decision for my mother had been an upper administrative decision. So I was coming to him. That's why I had come to talk to him. He looked a little bit surprised by that, but he was kind enough to listen. And so I told him that I felt like my mom was on a unit that was unnecessarily restrictive for her, which failed to address her social, emotional, and mental health needs. She was placed there because she had mild dementia, but primarily because they had a Hoyer lift there. Her placement was based on one single assessment given in time at a time that was convenient to the social worker. And it was based on what my mom couldn't do, not on what she could do. And that I felt there was a continuum of a care gap between those folks who had mild dementia and significant physical needs. And that this was the only place that they could put her because of the way they placed people. Her placement didn't allow, I told him, her placement didn't allow for any input from family or even the folks who had worked with her in rehab, who told me, don't let them put her on the Alzheimer's unit. I did not tell him that part, but they didn't ask for input from those folks. She didn't need to be on a secured unit because she wasn't mobile. She couldn't move around, so she wasn't going to escape. She wasn't a runner. She didn't wander. She wasn't aggressive. She was able to feed herself. She could carry on a very coherent conversation with people, and she craved interaction with her peers, which she wasn't able to get at all. Like I said before, she never forgot a face, ever. She never forgot a story. And my mom recognized that this unit didn't address her needs. She asked to be with people who could talk. Her simple request was to sit at a table facing other people who could talk. That's all she asked me for. Although I wanted him to address that larger problem of that continuum of care gap, for the moment, I wanted to at least begin by simply moving the dining room table, by simply putting someone else at that table with her who could speak. I told him that the unit that she would live on, she would be living there the rest of her life, and it needed to be a place for her to live, not a place to give up and die. And that's what she was doing. It needed to be a new home for her, where she was heard, where she could access meaningful, stimulating, cognitively appropriate activities with other people with similar abilities. She needed to have this access to the same quality of food as everyone else in the facility. Everything they gave these folks on this floor were pureed. She didn't need that. She could feed herself. Fortunately, the administrator listened. He went and talked to my mom. like I had asked them to do. Just talk to her. You'll know that this isn't an appropriate placement, but they wouldn't. But he did. And then he told the director of nursing to place my mom on the floor that addressed her significant physical needs without compromising her emotional well-being. So they moved her, thankfully. But the director of nursing came in and talked to me, and she said, "I see you got your mom moved." And I said, "Yes, I'm grateful for that." And she said, she pointed at me and she said, "I guarantee you in a month's time, she will be right back on that secured Alzheimer's unit." And she said that in front of my mom. Well, my mom lived for another 5 years. She developed meaningful, lasting relationships with folks on her floor, with the staff. Some of the staff called her their mom. She comforted others who came in. That transition was hard for everybody, we know that. But she would go in and she would hold people's hand and she would listen and she would let them talk. And she would help to make it easier for other people to come into the facility. Other residents came and visited her in her room. She participated in every single activity that was offered to her. And she made a difference to others in her last 5 years of life. That's what life was all about for her, was to make a difference. She said it was all about doing the best you can every single day. That's all. And she did that. And if we hadn't been able to move her, I really believe she would have died within a month's time. And that is my story. So I think the important piece from this for us as a family, for my mom as a person, was that you can't place people based on a number, and you can't place people based on not talking to anybody who knows her. Every one of us could have told or talked to her. You can't place her without even talking to her, without seeing what gifts she had instead of what deficits she had. And I know that my mom wasn't the first person that this happened to. So I think that placement piece needs to be different. Families and folks going into facilities need to have the greatest weight of input into this. And had I found an administrator who wasn't willing to listen, my mom would have died. I strongly believe she would have died. She was dying in a very short period of time while she was up there. I think we have to remember that this is where they're living the rest of their lives, and we need to make sure that we make that the best quality of life for them that we can. I think it's as simple as that, is to listen, get input, and really weigh that input instead of get input and then make the placement without considering that at all. I really think that's all we would have needed, was that.
Well, Sue, I really appreciate you sharing that story. I can still hear, I'm sure it's been a few years since the situation occurred, but I can still hear the emotion, the care you have for your mom. And those things are very emotional to the family, to the person involved. And I think sometimes the staff forget that. And yet you also showed that the staff started calling her mom. Some of the people there became very attached to her. So you showed the whole breadth of what can happen when people have to move into a different level of care.
And I have to say, really, Barb, is that the folks who worked with her directly were loving, caring people who I truly believe loved my mom. Once she was placed appropriately, we didn't have concerns after that, because I knew that they were providing the care that she needed and the interaction she needed to make her life good.
I hear a couple key things when I think of your story that just are so universal. And I've worked with families in my own personal experience is that you were a very strong advocate for your mother and you didn't give up, but you also highlighted the other woman who she saw in the hallway who didn't have anyone, and she should have that quality of life just the same as your mom, even though your mom had that strength among her family members. Someone who is a single individual should have that as well. Uh, Also, that you talked to staff directly and they said they couldn't make that decision, though they agreed with you. And sometimes when you have that bottom up philosophy within a facility, families, patients, and direct care staff joining together to make decisions, more appropriate placements are made. And then I think too that the administrator listened to you. Sounds like you were incredibly articulate and used a lot of terminology that healthcare professionals use. I don't even know if you knew that or not, but because you were able to advocate in such a way and speak to him in such a way, and that person took the time to go talk to your mother, I think that that was an amazing tool that happened and that occurred to help with a positive outcome as well. I also, as an aside, I was just curious to know, did that director of nursing ever apologize to you when no, okay.
No. But when we'd have those care plan meetings every, I can't remember how many months, I remember her saying, your mom's doing very well. And I wanted to, and I said, yes, she is. Thankfully she is. But no, never an apology, nothing to acknowledge that really wasn't helpful to my mom at all, how that was done. So yeah, sadly.
I mean, and you also highlighted, they seem very straightforward, very simple things, but very powerful things. Your mom took a test, and I think I might even have known the cognitive test that you're referring to at a time where she was in transition. She was probably very emotional. And it wasn't a baseline for her. It wasn't a typical situation for her. And not to even repeat it a week later or, in a different environment, just to see what the difference could be. And also that there are multiple cognitive tests out there that maybe staff and facilities should look at and not just have a certain one. There's all sorts of reasons. It doesn't sound like your mom would fit in this category, but, English proficiency, language, all, even cultural issues can enter into some of those tests. And I was a social worker who used to give those tests, and I didn't always enjoy it because I knew that there were multiple factors that impact the outcome of some of those tests. But also just incorporating the family and the patient into their care and looking at the person from a strength-based perspective, all of those things are really highlighted in your story and very important to remember. I think that integrating family members into all levels of care, looking at advisory councils along with those care plan meetings, making sure that there are times that the family can come or making them accessible for them. Also making sure that the patient can come and present what their concerns might be, having a patient and family advisory council at the facility as well. All of these things can really help with preventing what happened to your mom. But so happy to hear that there was a positive outcome, that in the end, that particular residence was willing to work with your mom and you and your family and help her have the best possible life that she could living in. And it is a person's home. People need to remember that, and that it's so important that we think of it as their home and try and accommodate that as well.
And this was considered one of the best facilities in the area, and which worries me then. If this was the best, and it was, for as far as care goes and loving people who worked with her, that's absolutely true. But those gaps of not really having families involved, the people who know her most involved was horrible. It was a horrible experience. And this was only, she died 5 years ago. So 5 years ago in April. So it wasn't
Not a long time ago. Yeah.
a long time ago.
Yeah. Oh my goodness. Well, Sue, thank you so much for sharing your story. I know that there were a lot of emotions, happy and some challenging ones as you told it, but I really appreciate you taking the time today and presenting this perspective. And I think a lot of people will learn an awful lot from you sharing your experience with your family and your mom.
I hope. Well, thank you, Barb.
Thanks.
I appreciate having the opportunity to do this.
Wow, you're incredibly welcome.